Hi, I'm Dr. Agustín Cornejo Esquerra. I'm a board certified plastic surgeon. And today I want to talk to you a little bit about the importance of checking your skin specifically for skin cancers. It's important given that the National Cancer Survivor Day is coming up. And I just want to share a few very simple details that everybody can follow. First of all, skin cancer is one of the most common cancers in the world, so no one is exempt. It doesn't matter your age or the color of your skin or the tone of your skin. We're all exposed to the risks. And here in Texas, because it's very sunny, we're all exposed to sun, and that's one of the main risk factors. So it's very simple to just to remember that if there is any skin lesion that pops up, okay, that wasn't there before, or if there is a lesion that perhaps a mole that has been there for a while and all of a sudden it changes, those are things that those are things that need to be evaluated. And the first thing to do is to go to your doctor. Can be your family doctor, can be a dermatologist, can be a cancer surgeon. And the first thing to do is really do a thorough evaluation, a history and a physical examination, determine whether or not there are risk factors, look at the wound, and then the next important thing is to do a diagnosis. Diagnosis is done in a relatively simple way. It typically entails taking a little piece of tissue and we send this tissue to pathology. The pathologist will let us know what type of cancer is. And that's very important because there are many types of cancers. A lot of them are very indolent, very slow growing, and benign. And so in general, if the skin cancer is diagnosed early, the treatment and the prognosis is excellent. And so this is important because if the patient is worried and they are worried about the lesion, they don't want to hear the word cancer, or they are afraid of actually leaving their homes and coming to a hospital or a clinic setting. I can reassure the patients that it is completely safe, that it is very important to do a early evaluation and early diagnosis, and if that's the case, most people get cured and can live a normal life. It really doesn't help to wait and to not take action because of fear of going out or fear of getting exposed. I will tell you that it is completely safe. All the clinics here at the Baptist Health System are equipped and are following the adequate protocols to protect our patients, to prevent inadequate exposure, especially now that we're dealing with the COVID pandemic. And so it's completely safe to get the lesions checked out. Your doctor will send you to the appropriate specialist. A diagnosis can be made, and all these lesions can be cured.
And Dr. Cornejo, tell us how fast it is to get a screening, and you can do it right in the clinic.
Yes, exactly. Screening can be done through a regular office visit. If there is a suspicious lesion, a biopsy can be done, which is relatively straightforward. It can be done in the office. Typically entails just a little bit of local anesthetic and obtaining a small piece of the lesion. And most of the time, that's enough to do a diagnosis. It takes 15 minutes. There's really no downtime. And again, that is probably the single most important thing, because that will tell you whether or not it's cancer, what type of cancer, and then the treatment will be based on that.